This is Speak Your Mind. It's good having you on the show. Today, our discussion will focus on cancer of the cervix or cervical cancer. It affects a significant number of Fijian women. We will look at the recent statistics, the importance of having a pap smear test, and also how uncomfortable it may feel for us as women to have a male gynecologist do it. Actually, we have a male gynecologist in studio. He will be speaking to us. It's Dr. Sailosi Ratumaitavuki, who is a consultant gynecologist at the Lautoka Hospital. Thank you so much for your time, Dr. Sailosi. And in the second half of our interview, we will be speaking to Seremaia Koroi, a health promotion officer with the PICCSI, with the PICCSI project. And Koroi will touch on the free cervical cancer screening that will be done in the West. Now, just to begin, Dr. Sailosi, let's start with some basic knowledge of the female reproductive tract. Where is the cervix and what is some of its functions?
Thank you, Gwen. The cervix is the lowmost part of the uterus, or the womb, or a baby bag. And there's a very narrow opening which allows the menstrual blood to flow through into the vagina, or the entrance which allows the sperm to swim up into the womb. So if you can imagine the womb to be a bottle of water and you invert it, the cervix is essentially the lid which holds everything in place. Basically the main function of it is, as I said, allow entry of the sperm, menstrual blood to flow out, and of course to hold the pregnancy in place.
Dr. Sailosi, could you tell us what is cervical cancer?
Cervical cancer is a type of cancer that originates from the cervix.
And when you look at cervical cancer, how common is it among Fijian women?
Thank you. This is a very important question. Cervical cancer is actually quite common in the Fijian women. It ranks as the second leading cause of cervical of cancer death for women in Fiji. So the first is breast cancer. Now, in a more regional stage for the Asia and the Pacific, here in Fiji we report one of the highest rates, and currently the incidence rate, or the rate of new cases that are diagnosed every year, we have about 27.2 to about 30 per 100,000, and that's about 10 folds more than our more developed countries like Australia and New Zealand. So it's quite a alarming statistic.
And to date, Dr. Sailosi, how many women have died from cervical cancer?
That information is not easily available to us, because we haven't been quite good in keeping track of records. But what I can tell you is that if a woman is diagnosed with cervical cancer in Fiji, then it has a case fertility rate of 87%. Now, what does this mean? It means that if you take 100 women who have cervical cancer, then 87 of them will die within a year. We have data to say that we report about 120 to about 160 new cases of cervical cancer every year here in Fiji.
Does this represent a high cancer burden for the country?
Certainly. This is something we would like to say. It's actually the tip of the iceberg. It's a problem that most of the Fijian women don't know. Is that we try, and at the moment we only screen. So pap smear is a screening test to test whether you are at risk of developing cervical cancer in the future, or whether you have cervical cancer. And we're only screening 7% of the population of women at risk here in Fiji. So to say at the moment that we have a lot of women diagnosed with cervical cancer, and we're only screening 7%, majority of these women are still out there.
Yeah, and well, coming up as well, we're going to be talking about the free cervical cancer screening that will be happening in the West. That's from next Monday till Friday. We'll be talking to Seremaia Koroi on that. But Dr. Sailosi, just to continue our discussion, what causes cervical cancer?
What we know at the moment is that due to this human papillomavirus and chronic infection and recurrent infection from this virus or HPV, it causes abnormal changes to the cells of the cervix, and over time these cells become cancerous. And so this is what we know so far about what causes cervical cancer.
How is the HPV virus? How is that transmitted?
It is for the types of HPV or human papillomavirus that cause cervical cancer is about 14 types, and these are transmitted sexually, and so with sexual contact, unprotected sex with somebody who has the virus.
When you're talking about sexually transmitted, with the staggering statistics that we have on cervical cancer, is HPV now the most common sexually transmitted infection in Fiji?
We know that HPV is the most important risk factor for developing cervical cancer. There are actually over 100 types of HPV virus, but we only know that 14 of them can cause cervical cancer. And what we do not know that well in Fiji is how many women have this infection, this HPV infection. There was a study conducted recently in Valley Center. They found out that there are actually 4 types of HPV virus that were detected, and that's as much as we know so far. So we don't really have a clue at the moment the amount of women in Fiji that have this HPV virus.
Just on the HPV virus, if I have HPV, would I know it? What are the symptoms?
Being infected with HPV is like getting a common flu, but with the HPV types that cause cervical cancer, it's quite good in hiding itself in the vagina and in the cervix. So really, there are no symptoms that a woman can experience to tell them that they have HPV virus.
Just another thing I'd like to ask you, Dr. Sailosi. The symptoms, like you had said, are not always obvious. So a woman may see bleeding and think, okay, it can't be cancer, it could just be related to my menstrual cycle. Well, what could be overlooked here?
Well, lots of things can be overlooked, but what is important is that as a gynecologist and an obstetrician, we would have to ask ourselves, is the bleeding due to a pregnancy-related cause or non-pregnancy related cause? Because certainly there are pregnancy-related causes that are quite life-threatening. But if they are not pregnant and they have abnormal vaginal bleeding, which is not due to their menstrual period, then one needs to ask themselves, is this due to cervical cancer? Especially if you haven't had a pap smear.
On Speak Your Mind, we are talking to Dr. Sailosi Ratumaitavuki, who is a consultant gynecology at the Lautoka Hospital. And also, just mark these dates down, a free cervical cancer screening will be done in the West from next Monday, the 13th, till Friday, the 17th of August. And we've got more details as well coming up on the show. Welcome back to Speak Your Mind, and our guest this morning is Dr. Sailosi Ratumaitavuki. If you need any questions clarified on cervical cancer, okay, you can speak directly to the specialist, Dr. Sailosi. You can call the studio 322-0906 or 322-0907. Dr. Sailosi, just to continue our discussion, what's the best way to find cervical cancer early?
Cervical cancer can only be confirmed by taking a cervical biopsy. So that's literally taking a piece of the cervix. This is normally done when you have an abnormal pap smear or an abnormal looking cervix. So I think the question one should ask is what is the best way to detect precancerous changes on the cervix? And the World Health Organization, or WHO, recommends that a combination of pap smears and testing for this virus, the HPV virus. And as the best way to detect more women who are at risk of developing cervical cancer. Now, I mentioned that the Hpv virus, in order for that to cause cervical cancer, it needs to be a chronic infection and a recurrent infection. So the pap smear, what it does, it basically we are trying to take a swab of the surface of the cervix, and we try and detect, we try and sample these cells, and they are examined by our pathologists under the microscope, and then they tell us whether there are these cellular changes caused by HPV. And that's what we're currently doing in Fiji. What we don't have in Fiji is testing for HPV virus or the human papilloma virus.
But just on pap smear, and thank you as well as a gynecologist for helping us better understand this. Is this the primary prevention? Is it life-saving?
Yes, this is a primary prevention method, and definitely it's life-saving, which means that we are trying to detect abnormal changes on the cervix before it becomes cancerous. The only downfall for Fiji is, like I said earlier, that a majority of women in Fiji have not had a pap smear. So only 7% of the population have been screened, and this is according to the latest Ministry of Health report. And it seems like majority of these women who are screened are the same people who have been having regular pap smears.
Very important point. Who should have pap smears, and what do these tests look for?
In Fiji, we are currently encouraging women between the ages of 30 to 49 to have a pap smear or a visual inspection of the cervix with the use of acetic acid, which is essentially a vinegar. And this should be done every 3 years. I guess for those listening today, if you are sexually active and have multiple sexual partners, or partners with multiple sexual partners and smoke, I strongly encourage you to have a pap smear test done, and you can visit your nearest health facility for this.
Dr. Sailosi, has the cervical screening guidelines changed for Fiji, and is Fiji also doing co-testing, HPV and pap test?
No, nothing has changed in Fiji. To be honest, we do not have a formal cervical cancer screening program. Yes, we are taking pap smears, and we are doing VIAs or visual inspection using of cervix using acetic acid. But it is not well coordinated enough or regularly done for us to say that it is a cervical cancer screening program. So this HPV testing to test for human papilloma virus, it's not done yet in Fiji. So this is what the PICCSI pilot study, or the Pacific Cervical Cancer Screening Initiative, is trying to do by next week in the western population for Fiji, is to screen for this HPV virus.
And also, can women over 30 be vaccinated against the HPV virus? If yes, is this even available here for us Fijian women?
Technically, the answer is yes, if she is still a virgin. Now, this would not be a cost-effective way of doing things in Fiji, given that it is an expensive vaccine to give, and the government generally doesn't encourage this, as it will cost them a lot of money. And as we know, HPV vaccination is free. But what the government aims to do is vaccinate girls by the ages between the ages of 9 to 13. The reason for doing this is that you want to give the vaccine before a girl becomes sexually active, because once they become sexually active, then they are at risk of contracting this virus. And so the reason for this vaccine is basically for the body to get is able to quickly identify this virus, and the body develops its own soldiers specifically to fight off this virus. So when they do have sexual intercourse with somebody who has this HPV virus, then the body is able to fight it off, and that reduces the risk of having cervical cancer. Because it's the chronic and recurrent infection with HPV that leads to cervical cancer.
Our discussion on cervical cancer this morning centers around women, but as HPV is passed through sexual contact, what are the risks or health problems for men? Are these also cancer related?
Yes, for men, the human papilloma virus can lead to cancer of the penis, especially for the originating from the foreskin of the penis. So men who are uncircumcised are more at risk of developing cancer of the penis because of this HPV virus. And yes, it's also associated with cancer of the anus.
This morning we are improving our knowledge on cervical cancer, and we thank the specialist for having this conversation with us, Dr. Sailosi Ratumaitavuki, and just reminding you as well that next week, from next Monday, a free cervical cancer screening will be done in the West. Seremaia Koroi, our next studio guest, will join us a little later on the show to tell us more. Welcome back to Speak Your Mind. And of course, this morning we are touching on women's reproductive health, specifically cervical cancer. And speaking to us is Dr. Sailosi Ratumaitavuki, a consultant gynecology at the Lautoka Hospital. And just continue with our discussion, who is at risk of having the HPV virus and cervical cancer?
Thank you, Gwen. Obviously, if you have sexual intercourse with somebody who has the human papilloma virus, then you are at risk of developing cervical cancer. So, to answer your question is having multiple sexual partners, early onset of sexual activity, and smoking. These are some of the risk factors related to women who have cervical cancer. Now, a colleague of mine, Dr. Nancy Sikiti, did a 3-year audit of cervical cancers managed in the CWM hospital here in Suva. I also did a similar study at Lautoka Hospital. What we found out was that 62 to 70% of women who have cervical cancer in that present to CWM Hospital and Lautoka Hospital are Itoke women, and the average age is about 50 for these women. So this is quite an alarming statistic, especially for the Itoke women. Currently at Lautoka Hospital, for the last 6 years, we've been averaging about 30 new cases of cervical cancer. As we speak right now, there are 74 cases that have been managed with cervical cancer at Lautoka Hospital. These are both new and old cases. And just to re-emphasize, the case fertility rate is 87%. So 87% of these women will die within a year after being diagnosed with cervical cancer. So if we are taking about 30 women, new cases in Lautoka Hospital, 26 of them will die within the year of having been diagnosed with cervical cancer.
Dr. Sailosi, why is PICCSI, why is this an important study for Fiji?
This is an important study because it's an extra cervical cancer screening initiative or test that can be done. Pap smears have been available in Fiji for decades, but we still seen lots of women who are suffering from cervical cancer and dying from it. So certainly things are not working at the moment. And I mentioned earlier that we are only screening 7% of these women here in Fiji who are at risk of cervical cancer. So I think it's about time that we try and add in a new initiative so we can try and pick up many more women who are out there who are at risk or already have cervical cancer. And the beauty about this PICCSI pilot study is that what they're trying to achieve is they are trying to test the women on the same day, whether they have the Hpv virus, and if they test positive, then treatment is offered on that same visit. But as what we are doing at the moment, if somebody comes in for a pap smear, they will have to wait about 6 weeks for the result. And then we know that about half of these women don't turn up for their results, and they are lost to follow-up. And then if they do turn up, and then we convey to them, no, the test is positive, we have to do an extra test called colposcopy, using a microscope to visualize the cervix, and then we take a biopsy, so a piece of tissue from the cervix. Now, this is to confirm whether they have cervical cancer or not. Now, that takes another 6 weeks to get the result. And we have only one pathologist in Fiji, and they have to, this one pathologist has to report on this test, and that's a lot of work for this one pathologist. So having this extra initiative, I think, is a fantastic thing for Fiji.
You know, Dr. Sailosi, when you mentioned like only 7% of women are showing up for cervical cancer screening, I wanted to ask you about the barriers, because, you know, for a woman, getting a pap smear is uncomfortable enough, and then, you know, having to walk in and see a male gynecologist like you know, you're having to carry it out is very awkward. What's, you know, some of the barriers, and can women also bring their partners in, you know, when they're being screened?
That's a really good question, Gwen. Now, the barriers, there are lots of barriers out there. It's not just women. Yes, women are shy to come in to have this test done, because it requires a vaginal examination using an instrument called a speculum examination, and that's done by a nurse or a doctor who is a stranger to that woman. So yes, you will feel uncomfortable. But a recent study published by Dr. Swaran Naidu at the from the VCCSI Health Center, she found out that 75% of women in the West, they do not know what pap smear is. Now, the fact that women don't know that pap smear is a screening test to test whether they have cervical cancer, and if they don't know that this is a test out there, then that is a barrier in itself. So promoting pap smears, and the other thing is that we know in the West, about 40% of the population live under the poverty line, and for a woman to come in to have a pap smear, that takes money. I'm sure that would be the least of their priorities. They'll prefer to ensure that the kids have the meals for their school are prepared, ensure that the husband is taken care of, the work at home is taken care of, rather than coming to the hospital to have a pap smear. Now, these are the barriers that we need to break, and the challenge is getting the word out that cervical cancer is here in Fiji, and it's a big and real problem.
And just on that, why did you choose gynecology, or did your specialty choose you?
That's a tough one. Well, certainly you have people in your life, or you come across people in your life that influence your career path. My mom is a doctor, so obviously I was influenced to follow in her footsteps. But if I take, say, 17 years back, when I was still in high school in Maris, and you tell me that I'm here practicing in this area of gynecology as a doctor, I would say I wouldn't believe that. But in saying that, I've always, when I started my training to become a doctor, I've always had interest in becoming a general surgeon, or a physician, specializing in internal medicine. But then I met Dr. James Fong when I did my medical internship, and he said, "Hey, why don't you try obstetrics and gynecology? It's a perfect specialty for somebody confused like you." And short story, here I am, and I love what I'm doing.
Well, I must say, male gynecologists are pretty brave to go into women's healthcare, and we salute the male gynecologists out there. Coming up, we're going to be speaking to Seremaia Koroi, and he's going to be telling us about the free cancer screening that's being mobilized in the West starting from next Monday. on Gold FM on Speak Your Mind. And well, this second half of our hour, we will be speaking to Seremaia Koroi, who is the Health Promotion Officer, PICCSI project. And of course, he will be talking to us about the free cancer screening that will happen in the West from next Monday. Seremaia, thank you so much for your time and welcome to Speak Your Mind. You know, it was quite shocking, the statistics that were shared earlier by Dr. Sailosi, that only 7% of Fijian women have been screened for cervical cancer. So, give us details about this free cancer screening.
Thank you very much. This free cancer screening that will be happening, as Dr. Sailosi has mentioned, in Fiji, we haven't done this HPV testing. We are doing pap smear in Fiji, which is testing for abnormal cells. But for this new screening that will be happening in the West, we have a team coming from overseas, and we also have the consultant, gynecologist and obstetric doctors from Lotok Hospital that will be accompanying the team on this 1 week screening for the Western.
So a whole lot of specialists.
Yes. So we are very fortunate. I'm telling the ladies for all the communities that I'm going to.
You've already done the groundwork, sorry,
I've been doing the groundwork from Singatoka, Nandi, Mba, Tabua, and this week is my last week for Rakiraki. So I've been telling the ladies that we are very fortunate to have a team of specialists that is coming from overseas, and we have gynecologists that will be part of the team that will be conducting this screening on the day. And as Dr. Sailosi has mentioned, when we do the screening for each site, we also we are testing for this Hpv virus, and we are giving the result on the same day. And we have requested the Ministry of Health Subdivisional Medical Offices for a site to provide for us, for the team, and we have they have provided us with a site from Singatoka and Nandi, Mba, Tabo and Rakiraki. And we have stations where we will have screening and station for testing. And if there's a problem, and we have a station 2 for treatment.
And this is the whole entire week, the whole 5 days?
Yes, for the whole 5 days, we have 1 day per subdivision.
Seremaia, why are women in the West being targeted for this clinic? And, which age groups are being urged to come in for cervical screening?
As a study that was done by Dr. Soranaidu, actually I was part of that team that was doing this the study in the rural Mba, Lotoka and Nandi, and we have seen that 40% of the women are below poverty line, and from that study too, we've seen that more than 40-50% of women have no knowledge on what is a pap smear. And I think that is why we are focusing much on the Western. And the age group that we are targeting for this screening, specifically from the ages of 30 to 50, because from this age group, we believe this is the time where women develop this cervical cancer. That is our focus target for women from the ages of 30 to 50. But we are not limiting our service. If you are more than 50 or below 30, we are all inviting all the women to make use of this free screening.
Seremaia, the cervical the screening methods that will be done on that day, it was interesting how you had shared earlier, when I was going through some of the information that you had sent through, about the Hpv Self-Test. I think most women would find this easier, but how does this test work?
Thank you. In Fiji, we are trying to also provide a self-test or self-swab. So on that day, we will be taking 2 swabs. So we've been informing women it's a pilot for self-swab. There's a station where we will give a bottle sample for women to go into the room Before that, we'll teach them how to do a self-swab. So they go in and they take their self-swab. They come out. They give the bottle to the doctors. And they will have another normal pap smear on another station. So the whole reason is self-swab and pap smear. For other countries, they've done this, and the result is accurate and the same. So there's no difference in the result that it will give. So I think the whole reason we are doing it for Fiji, so that we can have, this will be the pilot project for self-test. Maybe the next 2 years, we will have self-test rather than having a pap smear done by a doctor or nurse.
We all look forward to that day.
Yeah.
Seremaia, you had spoken about this being a pilot project, the women coming in for screening for cervical cancer. Is this voluntary? I mean, the permission will be first, obtained. Walk us through this.
Yes. We, from the awareness that I've been doing to communities for the women, I've just been informing them the importance of having a pap smear done. Because one of the reasons is, I usually tell women, women are dying younger. When you have families to look after, and you have cervical cancer, and the whole reason for talking about cervical cancer for women is that we can prevent cervical cancer. And yes, I think it's very important that we inform them to all come for this, because it's free and you don't have to pay.
It's important.
Yeah.
Yeah, and Seremaia, just speaking to you, I also want to acknowledge you. As a community health worker, I'm hearing that you're going into the villages, you're working at the grassroots level. It's so important for women to know and understand, and thank you for informing them as well. The fact that they need to attend this cervical cancer screening, which again is free, and it will happen in the West. Seremaia, could we just go over the locations again and the dates, please?
Okay. From Monday, that's the 13th of August, we'll be in Tavu Hospital at the antenatal clinic. So that is where we will station on Monday. So we'll be bringing our clinical bus, and we'll be using the antenatal clinic for the screening. And the screening starts from 8 a.m. till 4:30 p.m. For Tuesday, we are scheduled for Singatoka, that's on the 14th of August. Singatoka Hospital at the eye clinic. So everyone in Singatoka, the screening will be happening at the eye clinic at Singatoka Hospital. Same time from 8 a.m. to 4:30 p.m. And on Wednesday, we are coming down to Raki, and we will be having our screening done at the operating theater at the Raki Hospital. And on Thursday, we'll be in Mba, at the Mba Health Center. So we'll be using the Mba Health Center as our site in Mba. And on Friday, which is our last day, we will be in Nandi. And our site in Nandi is the Namaka Reproductive Clinic at the KEF compound. Same time from 8 a.m. to 4:30 p.m.
Cervical cancer screening is so important, and it's being done for free. Seremaia, is there any other advice you'd like to give the women listening in today?
I think the most important advice I give to women is, for women, you're always busy looking after the family. It's not bad. You're the first one to wake up in the morning. You're the last one to sleep every day. And most of the time, you are busy in organizing functions in the communities that you live in, even in faith-based organization. Women are always the first person to be there. But this screening is just for once, and your life too is very important. So you need to just go and have a check what's wrong, or if you have any problem. If you have a problem, you can get treated. So it's just a one-off test. And I know that you are busy with other things, so it's just a one-off thing that women, you can just take a time off and just have a checkup.
Thank you so much. Seremaia Koroi joining us on the show, who is also the Health Promotion Officer, PICCSI project. And of course, we also take the time to thank Dr. Sailosi Ratumaitavuki, consultant gynecology at the Lautoka Hospital, our in-studio guests on Speak Your Mind. On Speak Your Mind, well, I'm your host, Gwen McGoon, and of course, Seremaia Koroi is also joining us, who is the Health Promotion Officer, PICCSI project. Seremaia, I had spoken earlier about the value of community health work. You're at the front line, as there can be such a huge disconnect, outside of hospital and dispensaries. How are you providing adequate health care, in terms of women in the rural areas and in terms of women's reproductive health?
I think, first of all, I would like to take my hats off for community health workers. They are really doing a great job in the communities. And as working as a frontline for this project in the community, actually it's not an easy task to work in the community, because we have to work with a community in their own time. We cannot always bring our time, and we try and gather the women to come, and so we have to work according to the community's time. And what I acknowledge about the community health workers is that they try to make an effort to collect these women. So they make an effort to collect these women and get them to come for this awareness program. And what I usually do in the community is that where there is a function happening, if there is a soli or if there is a church service, I just tell them I can just come in and they can just give me a time for me to speak on this women's health. So I work according to the community's time. That is one of the importance of working with the community, because they have other things to do in the community. So it is always best to work with their time.
And just, speaking about you working with women in the community at the grassroots level. Earlier, Dr. Sailosi and I was touching on the barriers of women coming in for cervical cancer screening. What have you heard directly from the women?
Yeah, I think the barrier is, one is they feel uncomfortable and they feel shy or ashamed having their pap smear done, or they might have a bad experience with the last pap smear. That is some of the barriers that they've had. But most important is to tell them that this screening, you will have a team of specialists, and you don't have to be afraid of having pap smear done. And we will try to convince them that they will have a specialist team that will do a very good pap smear. That is very important to relate to the community because of these barriers, and that is one reason why women do not come for the pap smears.
Once again, the free cervical cancer screening will be done from next Monday. It starts next Monday, okay? That's on the 13th. It's at the Tavua Hospital, at the antenatal clinic, from 8 a.m. till 4:30. And maybe you could give us all the rest of the details, the locations where the team will be.
For everyone listening out there, we are inviting for Monday for all the women in Tavua. We'll be having the screening at the Tavua Hospital at the antenatal clinic from 8 to 4:30 p.m. And on Tuesday we'll be coming over to Singatoka, and we'll be having the screening at the eye clinic for all the ladies in Singatoka. It's only one day for Singatoka. We are coming up at the eye clinic at the hospital, and that's from 8 to 4:30. And on Wednesday, we'll be coming down to Reproductive Hospital. So all the ladies in Reproductive can all come over at the Reproductive Hospital. from the same time, from 8 to 4:30. And on Thursday will be in Ba. For all the ladies in Ba, we'll be having it at Tamba Health Center. Okay? Not Tamba Mission, at Tamba Health Center, near the Kornombu House. Same time from 8 to 4:30. And in Nandi, we'll be having it at the Namaka Reproductive Clinic. And that's in Namaka, at the KEF compound. Same time from 8 to 4:30. For all the women in Nandi, you can all come to Namaka Reproductive Clinic.
Thank you so much. Seremaia Koroi speaking to us then, the Health Promotion Officer, PICCSI project. And earlier as well, we thank our other in-studio guest, Dr. Sailosi Ratumaitavuki, a consultant gynecology at the Lautoka Hospital. And well, that's Speak Your Mind for another Tuesday. Till then, you have a great day.